Hey everybody, it's Dr. Dave, Psychiatry. Thanks for joining me on the YouTube channel today. Today I'm talking about amount of medication. The reason I'm talking about it is a very common question in my practice when someone asks, hey doc, isn't that a lot of medication? Or doc, do I need more medication? Is that not quite enough? I have to answer that question frequently. And the most accurate answer is you need the right amount that helps you. If you've already watched the Troubleshooting Brain Chemistry video, you understand the concept of trial and error and how we pick a target, take a medication to try to move a brain chemical and either move it up or down and see what the result we get. And we work that cycle until we have an answer. But one of the most common mistakes that I see when I get a referral or a patient comes to me having been treated by other prescription writers, clinicians, is that a lot of times people don't explore what is called the dosage range. All of my medicines, all the psychiatric medicines, the medicines that move brain chemistry, have a dosage range. So for example, Prozac has a dosage range of 20 all the way up to 80 milligrams, and that's approved and that's rational and that's the right amount. So if someone says, hey, isn't 80 milligrams a lot, Dr. Holmes? Well, no, actually in the book it says 80 milligrams is fine. So what we do though is we cut those, I typically cut those ranges into what I call dosing notches. So the dosing notches for Prozac would be 20, 40, 60, and 80. For Zoloft, for example, sertraline, that would be 50, 100, 150, 200. Cymbalta, the blended medicine that boosts both serotonin and norepinephrine, typically only has two dosage ranges. A lot of people try 30 milligrams. 30 milligrams really is not very good of a treatment dose, so I typically start with 60, and then I'll go to 120, and that's it. After 120, the idea is any more is not going to be likely to be very helpful. So even though in experimental settings, a lot of times you'll read about patients getting higher dose of Prozac, and I've read studies where patients were getting 240 or 300 milligrams of Prozac. The idea is at the high dosage range, you probably are not going to get any more benefit. You're not going to get any more traction from that. So once I hit the top of the dosage range, I typically think about adding or changing the medicine, adding something or changing the medicine to something else, or revising my hypothesis so I have a maybe I'm not in the right system. So one would think that sometimes you would approach it with a very small person with low body weight, maybe say an 85-year-old person who's tiny would need very little medicine, and a 300-pound bodybuilder might need a lot of medicine. In my experience, it's actually not true. You really don't know what someone's going to need. So the rational thing to do is to start what you think is an appropriate dose, which for a little person might be, half of a normal dose, but not get the idea that because they're low body weight or because they're older that they don't need more medicine, because it's very surprising. Sometimes I can have a woman who's 85 years old who really only benefits from 600 or 800 of Seroquel, which is close to the highest dose range, whereas 100 of Seroquel or 50 of Seroquel might take a 30-year-old muscular man and knock him out and make him to where he can't function. So it's proper and appropriate for you to think about the body weight, the age, all that stuff. But if you're a person who's saying, I'm not sure this is enough, it's okay to ask your doctor for more as long as you have a reason for it, your symptoms are not cleared, and you're not having side effects. And as long as it's not up against that high dose, that limitation, what you might call a guardrail for the highest dose that we go, then it's appropriate to ask, and you should discuss with your prescription writer about that. The analogy that I use with some people is that sometimes I'll pull out my keys and I'll say, okay, well, this key opens a lock. Okay, now if you're just listening to this, I'm holding up a key to a lock in a building. And if I push this key into the lock, as I'm doing now, but I only put it in just maybe a quarter of the way. If I just push it in, well, what happens? Well, nothing really. Okay, how about if I shove it in halfway? Nothing really. What happens if I shove it in 3/4? No, not yet. What happens if I shove it in all the way? Click, the lock turns. So in the key analogy, the amount of key matters. If you don't put the right amount in, you're not going to get the result you want, which is the open lock. Now, for some people, that first step, that's all the way in. Sometimes 20 milligrams of Prozac or 50 milligrams of Zoloft or half a milligram of Xanax completely does what it needs to do and it opens a lock. But sometimes it doesn't. And so the idea is you want to be able to explore the dosage range and not assume that a low dosage didn't work means the medicine doesn't work. One of the biggest mistakes I see in primary care when people are giving medications is they'll try the starting dose of one medicine, say Prozac, 20 milligrams, do that for a month or two. Well, that didn't work, so let's switch that and go to 50 milligrams of Zoloft. Do that for a month or two. Okay, let's do 20 milligrams of Paxil for a month or two. Well, you've taken 3 different serotonin boosters, and you've used the starting dose of each one of those. So in that analogy, that's like taking out a key and going, okay, well, I just shoved this in a little way. I only put this in a quarter of the way. It didn't work. Now I'm going to shove this one in a quarter of the way. It didn't work. I shoved this one in a quarter of the way and it didn't work. Well, the truth is you might have hit the right key and not the right amount. So you really have to explore the dosage range. And a lot of times that means you have to go, sometimes it requires great patience. Sometimes if it's, I'm using the Prozac and Zoloft analogies today, if you spent a month at 20, a month at 40, a month at 60, and a month at 80, that's 4 months of trying to decide if that's the right medicine for you. But you got to get to that 4th month. Because if you didn't have a good result at 60 milligrams, what happens if 80 milligrams turns the key? Turns out that happens all the time in my office. One of the most common referrals that I get is some person that's being sent over because their medications aren't working. And it's amazing. Sometimes all I do is just increase the dosage by 1 notch and the patient gets better. Now, I don't think that's because of me. I'm not some kind of magic. But when somebody comes to me and they get better, when all I've done is push the key in all the way, there's the reason that I teach this, that the amount of medication truthfully does matter. So basically, I'm encouraging you to think about the medicines you're on, think about where are you at in the dosage range, which is a very, very reasonable question for the person that's writing a prescription for you. If you're not getting the result you want, it's okay to ask. If you're up against the guardrail, then it's okay for them to discuss something, either changing something or adding something to it, which is how you work with your provider in trying to feel better. But the bottom line is, this is like a whole bunch of locks and keys. And if you're trying to figure out the puzzle, you got to be willing to use the entire length of that key, the entire dosage range of that medicine to try to feel better. So that's my encouragement today. And I hope that's helpful to you. And use the key analogy. I use it all the time. If someone doesn't understand your medicine, why you take so much medicine, if somebody's shocked that you take 80 milligrams of medicine, you can look at them of Prozac and just say, hey, that's the amount of key that I need. That's the amount that it takes for me to feel right. So it's really not a matter of, hey, you're a good person if you take less medicine. You're not as good a person if you take more, any more than, if you're a blood pressure patient, you're only a good blood pressure patient if you only take a little bit of blood pressure medicine, and you're a bad patient if you have to take a lot of blood pressure medicine, or diabetes, you have to take a little bit of insulin, you're good, a lot of insulin, you're bad. That's nonsense. That's not how we think about it. When it's medical treatment, you get the right amount for you. And exploring the dosage range is the best way to feel better in terms of your brain chemistry. So that's all I have about today. Thanks for coming to the channel, and thanks for coming to see me.